Night after night, you wake up again and again to use the bathroom. You feel exhausted, frustrated, maybe a little worried. Is this normal? Is something wrong? You're not imagining things. This pattern has a name, Nocturia, and it affects more lives more deeply than most people realize. I'm Dr. Motahare, and you are watching The Art of Medicine from Anatomy to Diagnosis. Here we break down complex medical topics into clear, empowering explanation. Because understanding your health shouldn't be confusing or overwhelming. In this video, we will unpack the real reasons behind nighttime urination, explore the most common causes from hormones to heart function, and discuss what you can do to take control of your nights again. If this resonates with you, I'd love for you to like this video, share your thoughts in the comment, and subscribe. Please turn on the notification so you never miss a topic that could improve your health. I want to introduce you to Mr. A, a 72-year-old man who was waking up 3 to 4 times each night just to use the bathroom. He felt exhausted and unsteady every morning. On reviewing his case, we discovered several contributing factors. He was drinking a lot of tea with dinner. His legs were swollen from daytime fluid pooling, and he was taking a diuretic too close to bedtime. By simply adjusting the timing of the medication, encouraging leg elevation during the day, and cutting back on evening fluid, Mr. A reduced his nighttime bathroom trips to just once, and started sleeping soundly again. It's a great example of how few small changes, guided by a correct diagnosis, can truly transform someone's life. So, what is the definition of nocturia? According to International Continence Society, nocturia is defined as the complaint of waking up at night one or more times to void, where each void is both preceded and followed by sleep. This is not the same as bedwetting or nocturnal incontinence. In nocturia, the person is consciously awakened from sleep in order to urinate. While one episode per night may be within normal limits, especially in older adults, 2 or more nighttime voids are often considered clinically significant. They've been linked to poor sleep quality, daytime fatigue, reduced productivity, and even increased risk of falls and cardiovascular issues. Epidemiological studies show that this condition becomes increasingly common with age. While about 5 to 15 of adults aged 20 to 50 report symptoms of nocturia, that number jumps to over 50% in adults older than 17. Nocturia is slightly more prevalent in men and especially common in those with other chronic health conditions. Several key risk factors contribute to this rise with age. One of them is a natural decline in antidiuretic hormone ADH, leads to increased urine production at night. The other one is chronic conditions such as obstructive sleep apnea, diabetes mellitus, and heart failure, which can significantly contribute. The other one is medications. Medications like diuretics, especially when taken in the evening, can worsen the situation. In patients with swollen legs or peripheral edema, lying down causes fluid from the legs to redistribute into the bloodstream, which increases urine output at night. So, as you can see, nocturia is rarely just a bladder problem. It often reflects a whole body issue, and understanding these risk factors help us tailor effective treatment. Actually, nocturia is far more than just a nightly inconvenience. Its impact on health and quality of life is often underestimated, especially in older adults. First, it fragments sleep, leading to insomnia and excessive daytime fatigue. Many patients also report difficulty concentration, irritability, and even memory problems, which are all consequences of poor sleep. Importantly, nocturia increases the risk of nighttime falls and fractures, and it can be count as independent risk factor for hip fracture. But the risk doesn't stop here. Nocturia has also been linked to cardiovascular problems. Repeated nighttime awakening triggers sympathetic nervous system, which can contribute to elevated blood pressure and long-term cardiovascular strain. This was clearly demonstrated in NIH Sleep Heart Health, which found higher rates of heart disease among the patients with frequent nocturia. On the top of that, the chronic disruption in the rest and social isolation often leads to depressed mood and reduced overall quality of life. So when someone says it's just getting up to pee, we must remember it's much more than that. To effectively treat nocturia, we first need to understand why it's happening. There are three primary mechanisms behind this condition. Nocturnal polyuria. This is when more than 33% of a person's daily urine occur at night. It's often related to reduced antidiuretic hormone, sleep apnea, heart failure, and peripheral edema. The second one is global polyuria, which refers to excessive urine production over a full 24 hours. This condition related to uncontrolled diabetes mellitus, diabetes insipidus, and sometimes excessive fluid intake. And the last one is reduced functional bladder capacity, which means that bladder cannot hold a normal volume of urine. This could be due to overactive bladder outlet obstruction, like benign prostatic hyperplasia, or chronic inflammation such as interstitial cystitis. In many patients, more than one mechanism is involved. That's why it's so important to do a thorough assessment, including history, bladder diary, and sometimes labs or imaging studies to figure out which factor is dominant. Once the primary cause is identified, we can tailor therapy to provide the most effective and targeted relief. The evaluation of nocturia begins with a good history. You start by asking detailed questions. When did the symptoms begin? How often does the person wake to void? Are there symptoms like urgency, pain, or hesitancy? What medications are being taken? And how much fluid is consumed, particularly in the evening? After history, we move to some essential diagnostic tools. A 3-day bladder diary is so important. It tracks each voiding episode, including time, volume, associated urgency, and fluid intake. Basic lab tests such as urine analysis, serum glucose, creatinine, and sodium help identify diabetes, infections, and renal disease. Measuring post-voided residual tell us if there is any urinary retention, especially in men with possible benign prostatic hyperplasia. And in patients with snoring, daytime fatigue, or obesity, we should consider sleep studies to rule out obstructive sleep apnea. When it comes to managing nocturia, behavioral therapy is the first-line treatment for all patients, regardless of underlying cause. These lifestyle changes are simple but often surprisingly effective. They empower patients to take control of their symptoms. First, we recommend limiting fluid intake for at least 3 to 4 hours before bedtime, avoiding caffeine and alcohol in the evening, as both of them irritate the bladder and increase urine production. For those with leg swelling, elevating the legs during the day or using compression stocking helps reducing fluid buildup that later redistributes when lying down. Diuretic medication like furosemide should be taken earlier in the day, usually at least 6 hours before bedtime, unless a different time is medically necessary. And for patients with obstructive sleep apnea, treating with CPAP can significantly reduce nighttime urine production. The other thing that before you go to bed, you can use 2 times to go to the bathroom. It means that first you go to the bathroom, go out, just have a short walk, and again use the bathroom to completely empty your bladder. The other one is using Kegel exercises. Whenever that you have a very bad urge of urination, do some Kegel exercises too fast. This will help you to get rid of that urge, and in the long term can help you to train your bladder. Mhm. These interventions may seem basic, but the science supports them. Behavioral modification can reduce nocturia episode by 20 to 30% without any medication. That's a meaningful improvement in the sleep, safety, and quality of life. That start with simple, everyday choices. When behavioral therapy isn't enough, we consider pharmacological options, but always with caution, especially in older adults because of side effects. The type of medications differ by the etiology. If you have a benign prostatic hyperplasia or reactive bladder or neurological problems or kidney disease or urinary bladder infection or constipation or anything else, the type of medication is based on underlying cause. There are multiple advanced interventions for managing nocturia too. These interventions are considered third-line treatment for patients with lower urinary tract symptoms who have not achieved satisfactory symptom control with pharmacologic and behavior strategies. A comprehensive discussion of potential risks, benefits, and alternatives must precede their use. Choice of treatment depends on underlying pathology, patient's preference, and risk profile. Multidisciplinary evaluation and patient counseling are essential before intervention. And the last word, nocturia is common but treatable. First, identify the cause and then treat it with behavioral, medical, and interventional therapies. Don't ignore it because it affects the quality of your life and also your safety. Thank you so much for watching. I hope this video helped you understand that nocturia is not just a normal part of aging. It's a real, treatable condition that deserves attention. If you found this information helpful, please consider liking this video, subscribing to the channel, and turn on notifications so you never miss an episode.